Greetings, it's Dr. Lipi Roy. Welcome to Women's Health Wednesday. April is Sexual Assault Awareness and Prevention Month. Every year during this month, community-based organizations, government agencies, rape crisis centers, businesses, campuses, and individuals worldwide plan events to highlight sexual violence as a public health, human rights, and social justice issue, as well as reinforce the need for prevention. A bit of historical context. In the 1970s, activists first began organizing on a national scale to reduce sexual assault and violence against women. Advocates fought tirelessly to bring a topic once taboo for public discussion out of the shadows and shed light on this widespread problem. The first rape crisis center in the United States, Bay Area Women Against Rape, opened in 1971, and it had two aims. One, provide counseling and advocacy to survivors, and two, educate the community. Their work paved the way for more groups and coalitions, and in 1976, the first Take Back the Night rally increased visibility of this social justice movement. Take Back the Night was a series of marches organized to protest rape and sexual assault, broadcasting the message that women should not be afraid to be out at night. By the 1980s, the National Coalition Against Sexual Assault was mobilizing groups across the country to take action at higher levels. In 1994, after a long campaign, Congress passed the Violence Against Women Act, the first legislation to require law enforcement to treat domestic violence as a crime and not as a private matter. In 2001, the first official Sexual Assault Awareness Month brought the issue into public consciousness and reinvigorated a national network of events and support groups that raise awareness and provide resources to survivors and those at risk. The Rape, Abuse, and Incest National Network, or RAIN, supports a network of over 1,000 rape crisis centers. Young women are particularly at risk of sexual violence. 82% of all juvenile victims are female, and 90% of adult rape victims are female. Women aged 16 to 19 are 4 times more likely than the general population to be victims of rape, attempted rape, or sexual assault. Women aged 18 to 24 who are college students are 3 times more likely than women in the general population to experience sexual violence. And women of the same age group who are not enrolled in college are 4 times more likely to experience such violence. According to RAIN, somewhere in the United States, a woman is raped every 2 minutes. Globally, girls and women face higher rates of sexual violence. Nearly 1 in 3, or 736 million girls and women have been subject to physical or sexual violence at least once in their lives. And this number doesn't include sexual harassment. Those in lower middle income countries and regions are disproportionately affected. 81,000 women and girls were killed in 2020 worldwide, among whom 58% died at the hands of an intimate partner or family member. This equates to 1 woman or girl being killed every 11 minutes in their own home. So, what are the health consequences of sexual violence? The effects aren't just physical, they're emotional and psychological, and they're short-term and long-term. Survivors of sexual assault experience higher rates of depression, anxiety disorders, unplanned pregnancies, and sexually transmitted infections, including HIV. And in some cultures, the survivor and her family are the ones who are victimized. In Nepal, for instance, which is one of the highest rates of child marriages and where child rapes are arising at an alarming rate, women and girls face a culture of stigma in a society that prioritizes a woman's honor. When a girl is raped, it is the girl who is perceived as bringing shame to the family and who will have a difficult time finding a husband as she is no longer a virgin. Sadly, many countries in Asia, Africa, the Middle East, and elsewhere oppress women in a similar manner and treat women and girls as second class citizens. So, how can we change this widespread human rights violation against girls and women worldwide? First, there are many resources that exist to help survivors cope with the trauma of gender based violence. RAIN offers 24/7 a 24/7 hotline, 1-800-656-HOPE or 4673. The US Department of Justice National Sex Offender Public website is the only US government website that links public, state, territorial, and tribal sex offender registries from one national search site. UGIMA provides resources for Black survivors, and the Asian Pacific Institute on Gender-Based Violence assists Asian, Native Hawaiian, and Pacific Islander survivors. There are also resources for immigrant and human trafficking survivors. So, how can we prevent gender-based violence and sexual assault? 4 ways. 1, changing social norms. 2, teaching prevention skills. 3, empowering girls and women. And 4, creating protective environments. We all have a role to play in preventing sexual violence. Parents and teachers can help young people learn about conflict resolution and how to handle emotions in a healthy way. Parents and teachers can also promote healthy sexuality by discussing topics like sexual behavior, communication, respect, and consent. Workplaces can implement and enforce sexual harassment prevention policies. All of us can promote social norms, such as speaking up against sexist language or behaviors that promote violence. Cultural change takes time, but it is possible. When there's a will, there's a way. We need to make the world safer for all human beings, especially for girls and women. Well, that's all for today. Tune in Friday, 3 o'clock Eastern for Head and Neck Cancer Awareness Month and World Art Day. Be sure to subscribe to my YouTube channel and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.